Hi there, I'm Dr. Sinan, GP and longevity doctor. I saw a patient this morning with memory issues and we walked through a screen of memory problems. I thought it'd be quite interesting for us to walk through that together, have an idea of what happens if you or your family member has an issue with memory. You come to your primary care doctor and you're wondering what the steps are to assess whether someone does or does not have a memory problem. The things that can cause memory issues. One of the commonest by far is going to be dementia. Dementia is a kind of umbrella term for diseases that affect memory and affect the executive functioning, i.e. the ability to do everyday stuff that we take for granted. Dementia is right up there with one of the top 3 diseases, I would say, that most people really fear getting, up there with things like incurable cancer and others. Dementia, like almost every other chronic disease, comes on over years. It doesn't come on in a month or so. Early days, there can be quite subtle signs. Another video on the early warning signs of dementia, and I don't want to kind of go into that again, but do have a look at that. What I want to cover today is what it feels like when someone does come into clinic. They're worried that their memory is failing. It's a pretty common occurrence too. It's not unusual that people will come in clinic with these concerns. One of the first tests that your doctor will do, usually after taking a history, maybe even speaking to a family member if they attend a clinic appointment with you, is to do a clinical assessment of your memory. These clinical assessments of memory are variable. They're basically tools or questionnaires that we can use that give us an idea if there is an actual problem with your memory or not. There's loads and loads of these different types of tools. Some are quite short, some can take 10-15 minutes. In the usual context of a clinic appointment in the UK, the average consultation time is about 10 minutes. So we generally need to have a tool that's relatively quick. The one that most people in the UK use is something called the GPCOG. This takes about 4 minutes to do. And the good thing about this, apart from the time being quite quick, is that it's very sensitive. That means it does exactly what we want it to do. What we're asking of the tool is for it to tell us, is the person that we're asking these questions to likely to have a memory disorder? Yes or no. It doesn't answer the question, what memory disorder does this person have, or do you have a memory disorder? It just says, are they likely to have one, or are they likely to not have one? If someone is likely to have one, it puts us in a good position for us to then refer for additional testing. That usually involves things like additional blood tests. That usually involves other things like neuropsychometric testing. So more advanced, longer, specific questionnaires that give us an idea about how your brain thinks and functions, as well as imaging, something like a CT or an MRI of someone's brain. So let's walk through it right now so you can understand it a little bit more. Just before we walk through it, just to say, this is just to give you an idea of what to expect. Your experience is likely to be very different than what we're walking through now. The other thing is that this is a tool for a clinician or a healthcare professional to use with a patient. So it's not been created to be used as a self-identifier for memory issues. You can walk through it now as we go through it, just to give you an idea of what it feels like to do this test. You don't need anything specific other than a piece of paper and a pen, and it should take just a couple of minutes. I'm using a website that's freely available online. You can access this from anywhere. When we do this in clinic, this questionnaire is actually baked into our clinical record. So I just click a button, it opens up the questions, and I can walk through it. So I'm going to click begin test. Let's get ready. This is what it feels like if someone comes in with memory issues and we start to ask them questions to screen to understand more if it's likely that they have memory issues. So the first part of this assessment is a name and address recall test. So basically, I tell the patient a name, a first name and a second name and an address. Then they need to repeat it back to me, and then I ask them to remember it, and I'm going to ask them again in a few minutes after we've asked the other questions for them to tell me again the name and the address. The name and the address that we use is here. So John Brown, 42 West Street, Kensington. Can you repeat that back for me, please? And then the patient repeats it back, and then we let them know that I'm going to ask them again in a couple of minutes. Sometimes we do have patients that can't even remember it, even though we're telling them straight away, and their ability to recall it immediately is impaired. There and then it's pretty obvious that they've got a severe memory issue, but nonetheless, let's carry on. So I've told you the address. We're going to move on to the next part. Then there's 3 or 4 questions before we go back to the memory recall. So the first thing is, what is the date today? Either get it correct or incorrect. Let's say it's incorrect, just so we can move on. Second question is about clock drawing. So this is part of executive functioning and understanding kind of time and space. The way that we assess this is we draw a circle on a piece of paper, and then we ask the patient to write in the numbers indicating the hours of the clock. 12 at the top, 3 at the right quarter, 6 at the bottom, halfway across, and then 9 at 3/4, and then all the appropriate numbers in between. We ask someone to do that, and we give them as long as they need to do it. Again, it's pretty obvious pretty quickly whether someone can or can't do this. Let's say someone gets that one correct. And then once they've created the clock that they've done themselves, we ask them to mark a specific time. In this case, it's saying, show me 10 past 11 on the clock face. So we're looking for someone to know where 10 and 11 is on the clock, as well as to do the appropriate length of the clock fingers that indicates hours versus minutes. So let's say that one's incorrect. And then the next question, can you tell me something that happened in the news recently? So I'm filming this in March 2024. The Israel-Gaza conflict is going on currently. The question that I asked to the patient this morning, when I asked them this question, they mentioned that this war is going on. So you want something that's relatively specific and obviously contemporaneous, nothing that is just generalized, something that indicates that someone is attuned to the environment, local as well as global. So let's say that's correct as well. And then let's move on to the last part, which is the recall. So now we're going back to the name that we mentioned earlier, as well as the address. John Brown, 42 West Street, Kensington. Each one of these parameters is 1 mark. All of the other parameters we just went over is also 1 mark. So it's 1 point for each correct answer. And then you don't get any points if you get it wrong. So let's say they got the name correct. And let's say they got most of the address wrong. And then we can click next. And then it comes straight to the score. That's it. So 9 very quick questions. Most of it is actually the address and the name and the recall. And then we get a score out of 9. So in this instance, the patient's got 5 out of 9. So depending on what the score is, that obviously gives us an idea about next steps. So the best score you can get indicating no memory impairment is 9 out of 9. That's when you get all of the answers correct. If that's the case, great. It's very, very unlikely that you have any form of memory impairment. What we would suggest is we may consider a blood test. There's not a need based on this test, but depends on the rest of the clinical history. And then maybe we can repeat the test in 12 months or so, depending again on the specifics of the situation. If someone gets a score between 5 or 8, that may indicate some form of impairment. In an ideal scenario, you'd get what we'd call an informant interview. So we'd normally like to get a collateral history, a history from a family member who lives with the patient who has the memory concerns, to give us an idea about what their experiences are. So that again is a separate formal questionnaire that adds credence to the score that we have and makes it more or less likely that someone has memory problems, and then a subsequent referral. Realistically, if someone's scoring 5, then we're already thinking this patient needs to be assessed more formally and needs a blood test that we will arrange, and then needs to be referred. In reality, we don't always do the collateral interviews, partly because people often come to the clinic by themselves. They don't always come with someone. People don't always have someone that they're living with that can give a detailed collateral history. In an ideal world, we would do it. Doesn't always happen. And again, we rely a lot on the rest of the clinical assessment, the medical history, other medications the patient may be on, or other risk factors to guide us about whether this patient needs further assessment. As a rule, we generally have a pretty low threshold for investigating memory issues on the whole. So if someone's scoring 5 out of 9, we're already thinking we want to investigate further and be much more confident that this patient does or does not have a formal memory issue. If someone's scoring obviously below 5, it means that they got the majority of the answers wrong. It's a kind of no-brainer. We need to assess them, the blood test, and then we'll do a referral to Memory Clinic in the UK, which helps arrange all the additional specific and longer questionnaires, as well as the things like imaging, and looks towards a formal diagnosis or not, as well as the appropriate treatment options going forward. Yep, so that's it. So that's how we walk through a memory assessment in most primary care clinics in the UK. It gives us an idea about whether someone needs to be referred or not. Even if you do score low, it doesn't necessarily mean that you have dementia or that you have a forever impairment of your memory. A lot of memory issues can be related to reversible causes like deficiencies in thyroxine, deficiencies in B12, folate, medications that you're on, and other factors as well that can be treated rather than a kind of slow decline in memory. So even if you do the test and you score poorly, there's no reason to be alarmed immediately. The most important thing is that you get assessed formally and that we understand more about what's going on as early as possible. Having a diagnosis can be really helpful to kind of manage expectations as well as obviously manage any particular condition. But yeah, thanks so much for watching. Till next time, hit that subscribe button. Until next time, stay healthy.